Well, greetings again. This is Dr. Bill Wyatt and with the American Orthodontic Society. And I want to continue explaining some things about the orthodontic course that we are going through and what we have done with this. And we have worked out the problems that we have in everything I can think about. And so one of the big problems is genetics plays a huge role in orthodontics. And it's because we're mixed up people. And I had a perfect example of this while I was in Nigeria. We had friends with people there in Ibadan, Nigeria. The husband had a PhD in agronomy and was teaching people how to farm and how to take care of their land and raise food that they needed very bad. And the mother was the librarian at the university there in Ibadan, and they had 2 daughters. Now these, what we call black people in America, but they were not much different than me. And if I had a good tan, I'd be about as dark skinned as they were. They were mixed people. They were mixed up with the Caucasian people in this country some way or another. However it was over the years, I didn't know. The mother was very light complected. The father was light complected. They had 2 daughters. The older daughter was very light complected, but the younger daughter came along and she had a darker skin, not near as dark as a lot of the guys working there in the office with me and that I had, but she had a dark skin. And I was trying to do her orthodontics, and her teeth were just too big for the bone structure she had. And I finally got her teeth in her mouth were taken out by cuspids and removing her wisdom teeth. I got her teeth in her mouth without having her face all bulged out like that. And now I looked back, and the layer of skin as we are formed is from childhood and from babies. The part of the body that forms the skin also forms the teeth of a person. So with somebody with dark skin would have a dark person's teeth, and her teeth did not fit in her facial structure. And that was foolish for people in the country. We were arguing about should we extract or should we not extract teeth. And so a group of people were trying to do orthodontics and never take out the teeth, so they were shoving teeth backward to keep from having the face too full out here, which is ridiculous. Or if they take something out in the middle and just bring them together. And that's why we teach people how to do that, is just take people out in the back. So there are people in certain countries of the world that have broad, round faces, and people who have other areas that are very narrow, and maybe we try to, these people mix. I had a Chinese lady one time who went back to China, and she brought me pictures of her kinfolks, and they all had protrusive facial structure. She says, I don't want to look like that. I want to look more like a Caucasian person here. And so we took teeth out and brought her teeth back in and made her face look more like somebody in the United States. And so this is the same way with people that just have large facial bone structure, and some of them have thin situations, and you can't take the teeth of one of them and put it into the other one and come out without reducing the teeth. So this is one of the main things that we look for in orthodontics, one of the main causes of orthodontics in the United States and all the world now, that people are mixed up so much. In just a few hours you can be from one side of the world to the other side of the world. And the people are mixed up now every way you can possibly think about. And so that is some of the main causes of orthodontics. And then we have all this smoke and development in places like London had so much cold smoke. People died from that. And we have people who have allergies and they breathe through their mouth. And the mouth breathing causes all sorts of problems too. So anyway, I wanted to explain this is genetics has a big role in what happens to the teeth. So I thank you for watching, and we'll carry on now with some other problems in our orthodontics. And I want to give you something that allows you to go to, we have over, I think somewhere around 970 videos that I've covered every aspect I could think about in orthodontics, except I don't get into cephalometric stuff too much. I get to where I can look at somebody and tell what needs to be done, but I do take steps on them that I can transfer their pace out. So anyway, I'm going to hush up now and we'll pick this up again and go further with it. Thank you for watching, and I hope you'll stay with our channel.